Hi Jan, thanks for talking to us on Medicine in a Nutshell. Could you tell me, how long have you been an ICU nurse, please?
I started in ICU in 1994, so that's 22 years.
And for people who don't know, and obviously nursing has so many facets to it, what does an ICU nurse do, please?
An ICU nurse is caring for the most critically ill patients in the hospital. You are usually caring for them on a 1-to-1 ratio, staffing ratio, which enables you to give holistic care to your patient. We have patients who are requiring ventilatory support. They may need support for their blood pressure and other organ support. It's quite intense. It can be quite stressful at times, and quite often we are caring for people who are at the end of their lives too.
And when one gets into nursing, obviously to get into ICU nursing, you've got to train further. How does one do that? If a nurse was thinking about it, how does one get into it?
It's your general training first. I believe that all students nowadays are given the opportunity to experience some time in a critical care area. And for me, it was something that I did as a student and knew that it was an area that I wanted to specialise in. Throughout your training, you wouldn't necessarily have to take any extra qualifications or anything, but post-graduation there are lots of opportunities to take on postgrad modules. There is a competency framework for critical care nurses, and that is in 3 steps, and that's quite an intense programme to follow, but it does give you a very good grounded knowledge for intensive care.
And in terms of doing these modules and so on, one does it while one is working. So
Yes,
yes.
Yes.
With the trust that people are working at, would they normally pay for you to do these modules? Or how does that work?
At the moment, yes, they do. We don't usually we don't give study time at the moment. Study time's a premium really, and you are expected to do study in your own time, but it is usually paid for, so you don't have the expense of that. There are lots of other outside agencies that offer conferences, study days, etc. The BACCN, the British Association of Critical Care Nurses, do lots of study sessions which quite a large number of our nurses attend, and those are quite inexpensive to use.
And I mean, you've been a critical care nurse for many, many years. Is that something you would recommend as a good career choice? I mean, what are the pros and cons? There must be both.
Yes, there is, but I absolutely love intensive care nursing. It's my passion, and I would recommend it to anyone. You get such a broad experience of every speciality throughout the hospital. We have general surgical patients, we have general medical patients, we have elderly care patients, we have orthopaedic, neurology patients, obstetric patients. Any speciality, you never know what is going to come in through the door. Every single day is different. And your knowledge is just vast, that you can gain as working in intensive care. I recommend that every student should have the experience of coming to intensive care, and as a job I just can't think of anywhere better to work. I love it.
I mean, I remember as a junior doctor, I did a stint in the ICU, and before that I was very scared of the critically ill patient. Is that why you're recommending that nursing students do a stint in critical care to get over that fear?
Yes, I think it does have a little bit of a stigma. People look at the patients, there's lots of infusions going in, lots of invasive lines, lots of invasive monitoring, things that you don't normally see on a ward. And when you first look at a patient that's undergoing all that treatment, it can be quite scary. It's not, once you've done it and you've experienced it and worked with it, it becomes less scary, and you get so much job satisfaction from being able to care for your patients so holistically, and the relatives and the family. There's a lot of family involvement, and the job satisfaction comes from knowing that you can do everything you could possibly think of for that patient.
And is there a shortage of critical care nurses in the UK? Do we need, I mean, obviously there's a shortage of nurses.
There is.
Stop.
There is, and I think that goes hand in hand with the fact that there is a shortage of nurses, full stop. At the moment, we do have vacancies within our trust, and we're constantly trying to recruit. I think it is a specialised area, and people who come into intensive care know quite quickly whether it's the right place for them or not. And usually, if they have decided that it's the right place for them, then they stay. We have people here on our unit that have worked here for 35, 40 years, and even though coming up to retirement age, they still don't want to leave that area that they love. So we have quite a lot of staff that are long-term staff. But with the shortages of nursing as a whole, it has been more and more difficult to recruit over the past few years.
Brilliant. Thank you so much. That's really a fantastic insight into critical care nursing, and I'm sure a lot of my nursing colleagues and nursing students and so forth find that very useful. Thank you very much, Jan.